it goes undetected, can cause cardiovascular disease, which can lead, is heart disease, stroke, can cause death. A lot of times, you wouldn't necessarily know that you do have high blood pressure until you come into the office and have it checked, because there's not a lot of symptoms with elevated blood pressure. Sometimes when people are experiencing high blood pressure levels that are, not just slightly above normal, they'll come in and complain of a headache or dizziness, or, feel sort of flushed, maybe blurred vision if it's really high. It's certainly something that we want to pick up on as soon as we can. The sooner we do detect it and work on treating it, the lower that risk for those things. I think we hear the terms high blood pressure or hypertension maybe more often than just blood pressure itself. So it is important to understand, what your blood pressure is. So blood pressure is the pressure inside the artery walls where your blood moves through to all of your organs. And typically we define that as two numbers. The top number we call your systolic blood pressure, and that is the pressure when your heart is beating or when it's active. And then your bottom number, the diastolic number, is the pressure inside the artery when your heart is at rest. We're kind of aiming for something as close to 120/80 or below that, but we make the diagnosis of elevated blood pressure, hypertension, at 130/80 or greater. There are a lot of different things that can cause your blood pressure to be high or cause hypertension. Smoking is a big one, high stress, inadequate sleep. And then, there are some other factors that you can't control, like age, race, some family history. There are also certain health conditions and medications that can drive up your blood pressure too. About half the US population has hypertension, so it's a very prevalent disease and something that we want to make sure we're watching out for.